Your body changed before you did. Before any word existed for what was happening, the information was already there. In the weight of your chest, in the sudden wrongness of a smell you had tolerated your whole life, in a tiredness that no sleep could touch. You did not need a test. Your body was already telling you. The question was whether you knew how to listen. For most of human history, that listening was everything. There was no strip to dip, no line to count. For roughly 300,000 years of anatomically modern humans, and for millions of years before that, in the bodies of our hominin ancestors, the only instrument for detecting a pregnancy was the body itself, and the accumulated knowledge of women who had been through it before and who had taught the women after them what to notice and when. This is not a story about the absence of technology. It is a story about a different kind of knowledge, older, more intimate, and in some ways more precisely calibrated than anything a laboratory replaced it with. The first signal is the one you already know, even now. Your period does not come. In a world without clocks or calendars, this was still felt. Hunter-gatherer women were not tracking dates on paper, but they were tracking their bodies. Among the Juhuansi of the Kalahari, documented across decades by researchers including Richard Lee and James Sussman, women nursed their children for years, suppressing ovulation through extended lactation, and felt the return of fertility by the return of bleeding. The absence of bleeding, then, was a recognizable break in a known pattern, not a mystery, a message, but the stopping of menstruation was only the most obvious signal. It was not always the first. The breast changes come earlier. Within 2 to 3 weeks of conception, the same hormonal cascade that will eventually reshape the entire body begins in the chest. The breasts swell. They become tender in a way that is distinct from ordinary monthly tenderness. More intense, more sustained. The areola darkens. These are not subtle changes to someone paying attention. And in a small band of foragers living in close physical contact in minimal clothing, moving through heat and cold and river water daily, the body was never abstracted the way it is today. Physical changes were visible. They were noticed, not only by the woman herself, but by the women around her. Then the nausea. Nausea and vomiting in pregnancy has been documented in over 20 non-industrialized hunter-gatherer and subsistence farming societies, as shown in a review published in Evolution, Medicine, and Public Health in 2023. It occurs in roughly 69% of pregnancies globally. This is not a disease of modernity. It is ancient. It probably evolved as a mechanism to steer pregnant women away from foods that could harm a developing fetus during the critical first trimester. The bitter, the rotten, the strong, the foods that smell wrong suddenly, precisely when it matters most. In a camp where food smells were everywhere, meat drying on a frame, fat rendering over a fire, marrow cracked open after a hunt, a woman who could not tolerate the smell of roasting meat was conspicuous. Within a band of women who had been pregnant before, who had watched their mothers and sisters go through it, that conspicuousness carried meaning. It was information passed from body to body, recognized across generations. This is where the social dimension of prehistoric pregnancy detection becomes impossible to separate from the physical one. The body's signals were not decoded in isolation. They were decoded in community. Anthropologist Sarah Blaffer-Hrdy, in her 2009 book, Mothers and Others, demonstrated that humans are cooperative breeders. Unlike chimpanzees, where a mother raises her infant almost entirely alone, human children have always been raised by a network of caregivers. Mothers, grandmothers, aunts, older siblings, and others Hrdy called alloparents. A human child takes an estimated 10 to 13 million calories to grow to independence. The extended dependency of human infants only made biological sense in a world where the entire group had a stake in each child's survival. If you are still here, it is because you sense that the intelligence of our ancestors lived in places we have stopped looking. In the body, in the group, in the accumulated wisdom that no one ever wrote down. And right now, we are in the middle of the most fascinating part of this story. Subscribe to Ancient Oddities, because everything on this channel is built to take you exactly here, into the life your body still remembers. And now, let's keep going. What this means for pregnancy detection is significant. A young woman, pregnant for the first time, was not interpreting her body's signals alone. She was surrounded by women who had been pregnant before, mothers, grandmothers, older members of the band, who recognized the signs in her behavior and her physical changes before she may have named them herself. The knowledge was social before it was individual, transmitted not through texts, but through presence, through watching, through a grandmother noticing what a young woman's face did when the meat came too close, and saying, "I know that look." Postmenopausal grandmothers, as Hurdy and researcher Kristen Hawkes at the University of Utah have argued through the grandmother hypothesis, were not reproductive dead ends in the Paleolithic. They were critical knowledge repositories. Their value to the band came precisely from what they knew, earned from their own pregnancies, their own losses, their careful observation of how the body changed and what those changes meant. The ability to read pregnancy in another woman's body before she could read it herself was part of their ecological role. And so that reading was cultivated. It was a skill the women who had been through pregnancy multiple times, who had attended births, built a diagnostic literacy that lived in accumulated attention across generations. Consider what a pregnant woman's body communicates to attentive observers in the weeks after conception. The darkening of the areola, visible before the belly changes. Increased prominence of veins across the chest. A subtle shift in posture and movement as fatigue sets in. Food aversions that drive behavioral changes impossible to miss in communal eating. None of this required a laboratory. It required attention. And attention was something our ancestors had in quantities we struggle to imagine. The practiced attention of people whose survival depended on reading their environment, including the bodies around them. We have one material artifact that may carry traces of how deeply this knowledge was held. More than 200 Venus figurines have been found across Europe and into Siberia, most dating to the Gravettian period, roughly 26,000 to 21,000 years ago. The oldest, the Venus of Hohlefels from Germany, was carved from mammoth ivory and dated by archaeologist Nicholas Conard and his team to between 35,000 and 40,000 years ago. Many figures show pronounced abdominal swelling, large breasts, widened hips, features consistent with pregnancy. Some scholars have proposed cautiously that certain figurines may have served as reference tools, portable representations of how the female body changes across pregnancy, carried and shared between women as embodied knowledge. This interpretation remains debated, but their existence tells us something certain. People in the Upper Paleolithic were paying close, artistically expressed attention to the female body and its changes. People also knew that birth itself required help. Anthropologists Karen Rosenberg and Wendy Trevathan have argued since Trevathan's 1987 research that human birth is uniquely difficult among primates, a result of the collision between the demands of bipedalism and the demands of a large-brained infant rotating through a twisting canal. The near universality of birth assistance across human cultures suggests this was not a recent invention. If birth required community, then the recognition of pregnancy, the months before birth, the preparation it permitted, mattered beyond individual awareness. Knowing early gave the group time to prepare. There is something in all of this that your own body still knows. The fatigue that arrives before any test could confirm it. The way certain smells become unbearable. The strange pull toward foods you have never craved before. These are not glitches in a modern body operating in the wrong environment. They are ancient signals, refined across millions of years, designed to communicate something urgent to a body and a community that had no other way to know. For millions of years, before the first written record, before the first test, before any laboratory, the knowledge of a new life was transmitted through flesh and attention, and the quiet intelligence of women who knew what to look for because they had been taught by women who knew before them. The chain of that knowledge is unbroken. It runs through every birth in human history. What else do you think we carry in our bodies without knowing that we do?